In this episode of Your Palm Beach Guide, we welcome Dr. Gustav Lo, founder and chief medical officer of RegenCen, for an informative discussion on hormone health, longevity medicine, and optimizing Healthspan. With more than 30 years of experience, Dr. Lo breaks down what hormone replacement therapy really is, who it can help, and why it has been so misunderstood, particularly in women's health. He also discusses recent FDA updates, evolving research, and the importance of working with properly trained providers. This conversation empowers listeners to better understand their bodies, advocate for their health, and move beyond the misconception that feeling unwell is simply a part of aging. Well, hello, Dr. Lowe. Thank you for joining us today.
Hi.
Oh, my goodness. We are so excited that we could get this on the calendar because we're partnering with you for our socials coming up as well. Just side note, we're coming to
Right,
see you.
right.
And I just thought this was a great opportunity to have you on. So thank you.
Yeah, very excited for both. Excited to see you in the office and
Absolutely.
excited to be here to talk with you.
Absolutely. So, can you just kind of tell our listeners a little bit about you and how you got into this role?
Yeah, sure. So I'm a family doctor. I'm an MD. I started my practice way back in 1990,
Oh, my goodness.
and I was a family doctor for 30 years. I ran several family practice clinics and urgent care centers
Mm.
back in Michigan.
Back in Michigan. Okay.
And as a side business, my partner, who then became my wife later on,
Oh,
she started an aesthetic clinic
okay.
in our practice in about 2001. And so that continued to ramp up and do really, really well. And I continued with my primary care. But
Mhm.
around 2020, I sold my primary care practices and brought the regenerative services into the aesthetic practice. And we kind of merged those two
Merged.
things.
And
So
were you in Palm Beach at that point?
no,
No.
no,
Okay.
we were still strictly in Michigan, and just in the past 5 years, we've really expanded.
Mm.
But I started getting into regenerative in my own primary care
Mhm.
practice in probably the 12, 13, 14 kind of time frame,
Mhm.
and so we were doing a lot of regenerative services there, and they were doing different regenerative services in the
Right.
aesthetic, so we combined.
Combined it. That's so good. Why reinvent the wheel when you can just merge them, right?
Right.
And kind of walk me through your process. Did you see a need right away when you first were getting into this portion of your practice? Or were you like, this is getting, this is being well received by my current patients. I'm sure others would be interested.
Yeah, I would say it's more like the latter.
Right.
I mean, going through a doctor's career, you start out
Mm,
and you're young,
right.
and you're kind of doing what you were trained to do, and you see a bunch of people. And as a doctor gets older, interestingly enough, their patient population gets older too.
Oh, they go
Patients
with you.
come
They
in,
age with you.
they do, they absolutely do. And when you start getting into that, middle aged range of your practice and your patients and
Mhm.
yourself, you realize that medicine has it has an antipathy. It's just kinda like a blind spot.
Ah,
It's worse than a blind spot. It's kinda like it's missing one eye,
right. Oh,
and
my
and
goodness.
it's missing one eye about aging, about the process of getting older, and also about people wanting to be their best.
Right.
In medicine, we are a disease-focused, practice.
Mm,
We're kind of a sick care system rather
right.
than a healthcare system. So everything's
Exactly.
very focused on somebody injured or sick or with a disease that comes in, and you have these interventions. But it's not really a lot about prevention,
Right.
and if people are doing well, you just kinda let them go, and that's where the big blind spot is.
Exactly. So in your practice, when you're working with these patients, is it all focused on preventative? Like, let's walk through the journey together.
Yeah, actually, I have to say, most of the people who come in are complaining about something.
Okay.
And it's a complaint of aging. It's like, I don't
Yes.
feel as much energy, or I don't feel as much enthusiasm, or I'm tired, or uh, I have hot
Right.
flashes. I'm not thinking straight. All sorts of
Exactly.
different things that people perceive as age related.
Right.
So that's usually what they're coming in for, and actually, age is in some respects a disease, and
Yeah.
so yeah, most of our patients, I'd say about 80% of patients,
Mm.
are coming in saying, "I don't feel like I used to, and
Right.
I would rather feel like I used to."
Exactly. And so what was the goal when you and your wife set out to do this together, like long term with your patients?
We wanted to be a full service sort of our family practice philosophy. We want to do as much for patients in the anti-aging realm as we possibly can under one roof.
Under one roof.
And so that's why we combined the aesthetic anti-aging with the internal anti-aging.
Mm,
So we call ourselves anti-aging from the inside out.
Oh,
It's
that's
everything.
so good.
And many of the concepts that you think about externally, microneedling and injectables and that kind of thing, a lot of those are actually regenerative
Mm,
for the surface tissues of our body. And the stuff that we're doing is regenerative for the internal stuff, the
absolutely.
machinery.
So I feel like right now in healthcare, hormone replacement therapy is almost like a buzzword. It's like ding, 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 winner, winner. Can you kind of help people truly understand what hormone replacement therapy is with your practice?
Yes, you're right. It's a huge
It's
buzzword.
like one
I
thing. Here we
mean,
go. You get hormone replacement therapy. You get hormone replacement therapy.
it's shocking how dramatic the change has been just in the past 5 years. You know, when we first started doing hormone replacement in a big way, I've been
Right.
doing it literally for over 30 years. But when we started getting into it in a big way,
Mm,
there was a huge amount of resistance. It was like an entirely new concept. Oh, that causes cancer. I would never do that.
right.
There was a lot of work to be done there. And then through whatever different
Yeah.
incidents that started happening, that's really changing. And now there's almost too much information out
There's
there on it.
almost too much
So a
information.
lot of confusion.
Right.
The bottom line is, in its best form, hormone replacement is simply putting back what you used to make.
Okay.
So women, when they start getting into perimenopause, certain hormone levels drop, progesterone and testosterone particularly, and estrogen levels are maintained, and sometimes they spike. So you get this imbalance
Mm.
around perimenopause. Let's say perimenopause somewhere late 30s to mid 40s, and then around menopause, everything goes away.
You're like, what is happening to my body?
Exactly. And that's a deficiency
Right.
when women's bodies are used to these three hormones in certain ratios their whole lives, their tissues depend on that stimulation. And when those receptors on the cells don't get that estrogen or testosterone fix anymore, then that's a triggering event for those cells to go into aging mode.
Oh, wow.
And they sort of go dormant or they even die. So those
Mm,
tissues start to deteriorate as soon as they don't get those hormones anymore. So it's really the most natural thing in the world to say, hey, if you've got a deficiency syndrome, let's replace that.
right.
And the problem that happened back in 70s, 80s, 90s, and the big study that came out in 2002 that screwed everything up, that problem was because we weren't using bioidentical hormones. We were
Okay.
using synthetic hormones, using a product mainly called Premarin. You remember that brand name,
That was a
Premarin?
long time ago. Yeah.
Yeah, a long time ago. Premarin stands for pregnant mare urine.
Oh, my.
That was actually the name of the drug, the brand name of the drug, and some genius back in the early '70s said, "Hey, let's name it after how we get it."
Oh, my
And so
gosh.
nobody really knows that. You can look it up. I was shocked when I found this
Yeah.
out. They actually pen these horses, pregnant horses, and they collect their urine and they take the horse estrogens out of the urine and they turn it into a pill that they give women and say, "This will be good for you.
Oh,
This will
my
get rid of your hot
goodness.
flashes." And it's not bioidentical. It's better than nothing, to tell you the honest truth, but
Right.
it's not great, and it does cause side effects, and it does cause some problems, and those problems surface to a very small degree in some studies, and it increased risks of some things,
Right.
so that's how hormone replacement therapy got a bad name.
Oh, my
So,
goodness.
it's very different now.
Yes.
Promise. Nobody uses horse hormones anymore, at least
Thank
very few of
goodness.
us, and so we use hormones that are atom for atom,
Mm,
absolutely identical to the ones that women and men make.
right.
And so we simply replace those. All we're doing is putting back what you used to have. And lo and behold, your body likes that, responds
Right.
to that, and starts performing and behaving in very similar ways to what it did when you were younger.
Oh, that's so good. Can you talk about just some of the symptoms that people that men or women experience when their hormones are out of balance? Like, what's
Yeah.
something to look for if our listeners are experiencing something like
Sure.
this?
Yeah, let's talk about perimenopause
Yeah.
first. That's one that there's a lot of information on
Mm,
menopause, right? But perimenopause in some ways is still kind of flying under the radar
right.
because women have been told and are told, you go into the doctor and say, I don't feel well. I feel like I'm bloated, I'm emotional, I'm gaining weight and I
Mm,
feel sluggish. Maybe it's my hormones because I read those are hormonal symptoms, which
right.
they are. The doctor says, "You still having periods?" They go, "Yeah." I
Right.
said, "Well, then
You're
it's not
fine.
hormonal. You're fine."
Oh my goodness.
And it's not really true at all because there's only one hormone really that regulates whether you're still having periods or not. And that hormone, estrogen, is still there and it's still going through cycles. But women really drop off on the progesterone and they really drop off on the testosterone.
Mm,
That can happen at different times for different women. It can happen as early as the mid 30s
my goodness.
and as late as the late 40s. But at some point in time, women are going to start to feel funny. But that old dogma is still around. And people go, well, if you're having periods, there's nothing we can do.
Right.
There's a lot we can do. If we replace those hormones and get them properly balanced, which is not that hard, then people go back to feeling the way they did in their 20s.
Exactly. And then,
And
like you said, they can age in a way that still makes them feel okay. And they don't feel like, like you said, you break out in a sweat if you're going through these things and you're like, what's happening to my body? It's really providing that comfort for those patients that's like, I can age gracefully almost.
yes, and perimenopause is where it starts for a lot of women. About 1 in 4 women will really be miserable with perimenopausal symptoms.
Mm,
And it's tired, bloated, gaining weight, low sex drive, poor sleep, all this
mhm,
stuff. But about 75% of people, it won't be that bad.
mm,
So that's, I think, why it flies under the radar.
right.
People talk to their friends and, is anybody having these symptoms? Not really. It's like, I
Right.
must be crazy or whatever. So
Exactly.
very isolating for women who have
Mhm.
these bad perimenopausal symptoms.
And what about men?
Men, men with testosterone. Um, they have very, very similar symptoms in a lot of ways, but that happens more slowly with men.
Okay.
Men's testosterone levels start, they're high in the early 20s, and they just kind of start ticking down, like going down a staircase
Mm,
over a period of decades. So guys, when they start feeling more tired or lower sex drive or less motivated or not sleeping as well, or that metabolism starts changing, gee, I don't build muscle like I used to in the gym. It used to be I could gain weight around the holidays and I just go work out for a couple
and it
weeks
would
and
go
it would
away.
go away. But they hit that metabolic wall. A lot of that is due to lower
Ah,
testosterone and lower growth hormone. But they think, oh, I'm just getting older.
mm,
And I guess I'm not 40 anymore, or not 30 anymore. But you never know what's just getting older and what's low testosterone unless you check your levels.
unless you check.
And here's the funny thing about men's testosterone levels. This is probably the really important thing. They've been dropping society-wise in North America for about 40 or 50 years,
Oh my
and
goodness.
nobody knows why. Even scarier, nobody is trying to figure out why.
Oh
There's like
no.
no studies out there trying to figure out why male testosterone levels have dropped. They've
Huh.
dropped probably about 40%
Mm,
in the past 50 years. There's a big study in like 2001 to 2012, and it showed testosterone levels in men dropped almost 30% in the
30%.
same age group,
Oh
right? They
my.
took 20 to 40 something year olds in 2000 and 20 to 40 something year olds in 2012 used the same testing methodology, same demographics of these people. And those testosterone levels were way, way down. Nobody knows why. In other words, low testosterone is extremely common now.
Mm,
About 1 in 3 guys under 40 will have low testosterone, and it just goes up from there. By the
yeah.
time you're 60, it's like 80, well, not quite 80%, more than 2/3.
Wow. Can you just touch on I want to talk about men real quick. How can you convince men that it's important to get this stuff tested? Because I feel like men have a hard enough time going to the doctor when they're sick. Like they'll be like, "Oh, I'm fine. I'm totally fine. I don't need to go to the doctor for a cold, let alone for this type of stuff."
Yeah. You're absolutely right, and this is something we were talking about in Palm Beach just last night.
Mm,
I was giving one of my talks, and there's a slide on men, and
mm,
there's a picture of a guy smiling, and it's about low testosterone, right? And the caption is, what if I feel fine?"
right.
And then the next slide says, "First of all, you don't." Because guys are always saying, "I'm
You're right.
fine, I'm
Always
fine."
fine.
And so a lot of our patients come in because their wives or their partners bring them in and say, you know, talk to the doctor about what's going on. And the guy
Mhm.
goes, What? I'm fine."
Yeah.
And then she turns to you and says, "I've seen this, 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 and this." And eventually the guy will go, "Okay, well, that's true."
Right.
But they have a really, really hard time asking for help or
Mm,
even admitting to themselves that things are not going well, that they feel tired or unmotivated or they're depressed or
mm.
they're getting fat. So I always tell women after this slideshow, so if you've got a grumpy old man who's putting a dent in your couch, drag them in and let's get things fixed,
Yes,
right?
that's so good.
So so what do we do to really encourage them? I think that people have to be honest with them and
Mm.
tell
Tell
them
them. You got to tell them.
because they're not going to do it themselves. They're
Right.
kind of like dogs.
Yeah.
Dogs have this hierarchical system and they don't show pain and they don't show disability because if they do, then that next
Right.
dog under them senses weakness, right?
Right.
And men are kind of like that.
Mm.
And I think it's genetic. I think we're kind of programmed to kind of sort of ignore
Right.
weakness or decline and pretend like it's not there. So
Yeah.
we have to tell them. The other people in their lives have to tell them, hey, I've noticed these things. What about that? And sort of get them to admit it and encourage them to come in.
Yes. Oh, I love that. Well, those are some good tools, everybody, to watch the men in your life, make
And
sure they're good.
I got one from an acquaintance of mine. His wife brought him in. I've got a text I can show you. It says, hey, is it possible that he has my text because he's a friend?
Yeah.
Not all my patients have my text.
Right. Of
He says,
course.
hey, is it possible that I'm actually feeling better already? I said, well, I don't know. When did you get
Right.
your pellets, your treatment? About a month ago. Yeah. I said, yeah, absolutely.
Oh,
What are you
good.
experiencing? He said, I'm on fire at work. I'm just,
Yeah.
I get up in the morning, and I work out. I've never done that in the
Yeah.
morning,
See,
and
it's like you're ready
all
for the
these things.
day.
He's ready for the day. So, like he was when he was younger. See,
Exactly.
and I would say we're talking about 90% of guys
Mm.
who have low testosterone will feel a dramatic improvement. Not a little bit better, a lot
A
better.
lot.
And about 10%, not a whole lot or a little bit better,
Right.
but 90% very, very big improvements.
No, that's so good to hear. I want to transition really quick to the FDA update. And
Yeah.
so earlier this year, the FDA made a major announcement regarding hormone replacement therapy. What changed and why is this such an important moment in women's health?
Great question.
Yeah.
November 10th, big day in our lives and in our field. Now we're moving into talking about menopause,
Right.
okay? And the FDA, the new commission of the FDA, Dr. Marty Macri, he's a change agent. This guy's an MD. He's been a big advocate for women's health and for hormone replacement for a long time, long before it was popular to be so. He was saying, "Look at this data. This is bad data." So
Right.
he's kind of been on our side, even though he's not in our field, which is
Right.
longevity medicine. So he came out and said, hey, those black box warnings on all estrogen therapies for women, the ones that say this increases your risk of breast cancer, we're taking those off.
Oh, wow.
We're taking them off because it's not true. And it's never been true. We
Mm.
put those warning labels on in, I think, 2006, 2008, in response to this erroneous, flawed study from 2002, and it was part of the big scare
Right.
theme back then. And he said that that's never been true, and we're going to take them off because that's put the fear of God into women. It's made them afraid of hormone replacement therapy.
Hmm.
It has took hormone replacement therapy to about a third of women, down to like 1% of women. He
Wow.
said this has been a colossal health disaster for women.
Oh, my goodness.
So then he had a press conference.
Oh, then he got a press conference.
The
That's
press conference is actually a lot bigger news than the headline, which is, hey, estrogen doesn't increase the risk of breast cancer.
Mm.
Okay. It doesn't cause breast cancer. And that is really, really big news because probably about 1 in 5 women, maybe even 1 in 4 perceive that they have a high risk of breast cancer because of some kind of family
Right.
relation or what they've heard, what they've read, what they've been told. About 1 in 4 women thinks they have a high risk of breast cancer. And so they always think, no, I can't ever go on hormones because
Mm.
it's going to increase my risk. So for that 25% of women out there, you got to clear your mind of everything you've heard about hormone replacement and breast cancer because
Right.
it's not true. We've been saying it's not true for a long, long time, but now the FDA says it's not true.
Yeah.
So that's one thing. But then he went on TV and he had this big press conference and he said really the important truth, and that is this isn't about getting rid of your hot flashes or sleeping better,
Mm.
okay? It's about reducing your risk for disease going forward. So there's not a single treatment out there, not a single drug out there that will do as much for women's health in general as they get older as hormone replacement
Oh,
therapy.
my
Now,
goodness.
one. And he talks about the reduced risk of heart attack and stroke by 40%, getting rid of osteoporosis,
Mm.
and dropping women's risk of Alzheimer's disease by up to 50%, some research says.
Wow.
You know, women are at double the risk of men of Alzheimer's disease.
I did hear that. Yes.
And if you do hormone replacement, your risk goes down to about what the male risk is.
Oh my goodness.
So
So,
these huge risk reductions.
well, and why do you think it took so long for that public perception to catch up finally to the true science of it?
It's because medicine took
Right.
a long time to
It
catch up
did.
to it,
Okay.
the practice of medicine. And the practice of medicine, I'll say it out loud,
Yeah.
is not science.
Okay.
It's sort of an engineering branch of science, and
Okay.
it's kind of like kind of like being a skilled carpenter,
Yeah. Okay.
taking or electrician or heating and cooling person is taking the scientific principles and actually putting them into practice. And so medicine is just as dogmatic as
Mm,
many other fields, and that's where this big blind spot comes in.
right.
Practice of medicine is focused on diseases, and there's a real aversion to intervening in the natural course of life.
Hmm.
And so when this false cancer scare came out, doctors said, well, boom, we're done with that. We're not going to intervene in menopause anymore. It's
Hmm.
normal and natural. We're going to encourage women in different ways, but we're going
Right.
to cut off this stuff. And that was a huge mistake because the evidence did show that it reduced the risk of death
Oh,
by these huge amounts. There are estimates that somewhere between 60,000 and 100,000 women have lost their lives, have died prematurely due to
goodness.
lack of hormone replacement therapy, and the option for hormone replacement therapy just in the past 20 years. Those are huge numbers.
Those are huge numbers. What about for the women who are in their 60s, early 60s, approaching 70?
Mhm.
Is it too late? Are they able to still?
This is probably the number one question I'm getting right now.
Yeah,
And the answer is twofold. It's too late for some stuff. I want to be honest. It's
right.
the scientific truth that if it's been more than 10 years since you went through menopause, we can't actually prove that it reduces your risk of heart attack or stroke.
Mm,
But you can, for the rest of your life, protect your bones, improve your bone density,
bone
improve the quality
density.
of the bone,
I want to talk about that too. So,
and improve muscle
right.
mass, which nothing else does other than hormone replacement
Mm,
therapy, testosterone in particular.
right.
And it will reduce your risk of on and on and on.
Right.
But we can't say it decreases the risk of heart attack and stroke,
Mm,
which is a big thing. But no, it's not too late. It's never too late. One of the reasons it's never too late is because most women continue having menopausal symptoms or develop more
mm.
menopausal symptoms as time goes on. So a lot of people don't know that their poor sleep is probably due to lack of menopausal hormones
Wow.
or their urinary issues, very frequent urination, urgent urination, or vaginal problems that occur in the
Mhm.
60s. A lot of women think, boy, I guess I'm getting old because my vagina is dry and it
Yeah.
hurts having intercourse and so forth. They don't necessarily connect it to menopause because menopause was 10 years ago.
Right.
But it's that lack of estrogen over a long period of time that causes the deterioration of those pelvic tissues that leads to those urinary and vaginal problems. And
Wow.
replacing the testosterone, excuse me, getting too
No.
excited.
Well, this is great.
Replacing those hormones, it's like almost like snapping your fingers and everything's back.
Oh my goodness. Well, and I just asked that though because sometimes women in their 60s and 70s they're just they hear about these, these opportunities to take these replacement therapies.
Mhm.
And they're like, "Oh, that's not for me." Like they just dismiss it
They
immediately.
do.
They dismiss it and it's like, "I don't even want to learn about it." It's
Mhm.
not so it's really just trying to help them kind of at least listen and hear and saying that this is, an option for you.
Right.
Right.
One of the things that the first thing we do when somebody comes in, and a lot of people come in skeptical.
Right.
For example, many of our clients come from the aesthetic side of our practice.
Right.
They've come in for a long time for various things on their face or
Mm.
body, and somebody says, "Hey, what about hormones? What do you think about that?" And they're like, "Nah, I'm not interested." So a
You're
lot
like,
of people, it's kind of it takes a lot of conversation, and
right.
so we start our conversations with those, say, skeptical or resistant patients by
Yeah.
just asking a bunch of questions. You know, how's sleep? And how's your energy? You notice any reduction in energy from, the time you were 52 to now? And almost everybody says yes.
Yes.
Do you get tired in the afternoons? And all these things that people think are aging
Mm.
and are really hormonal. And so if somebody answers yes to 4 or 5 of those,
You're like,
then you say, hey, do those bother you? They
uh-huh.
go, Well, yeah, they bother me. It's like, well, would you like to get rid of them?
Yeah.
What do you think life would be like if you did have great energy when you woke up in the morning? Your eyes opened up and you said, "Wow, I feel really good, and I've got about half a dozen things I'd like to get done."
Right. And you're
Or
motivated.
and you're motivated, or at 4 o'clock, you're not like,
Like, I need to take
"Oh,
my
boy."
afternoon nap.
Yeah, exactly. Or this is one that people don't talk about a lot necessarily. It's
Yeah.
what about sex drive?
Right.
And when you ask people about that, sex is a huge part of a couple's life.
Mhm.
Most couples, and they'll kind of reluctantly say, "Oh, well, that's not such a big deal anymore." It's like, well, why?
Why?
Would it
Right.
would it be nice if it was a big deal like it was when you were in your 30s or 40s
Right.
or 50s or whatever? Why does that have to go away?
Yeah.
And so that's the real one they come in and go like, "Oh my gosh,
I know.
I can't believe, blah, blah, blah. My
Yeah.
spouse, whether it's husband or wife, is so happy, and
Right.
well, I didn't believe it. I didn't want," but yeah, that comes back too.
That's awesome, though. That has to be such a good feeling for you, though, just to especially for, like, the couple's, perspective. It's like you see these couples come in day 1 and they're like, "Oh, I don't know." And then they come back, however long it takes, and it's
Yeah,
like, "Oh, it's like a brand new life."
it's a happy business. I
That's
was in primary
awesome.
care and urgent care for a long, long time,
Yeah.
and those were not necessarily happy businesses
Right.
because those are disease focused. You've got people who are sick or injured or whatever, and they don't always
Mm.
turn out great,
Right.
right? But when people come in for BHRT, they're super, super happy.
Yeah.
Well, okay, now here's another one. Women will come in their first post visit. It's like, "Oh my God, I'm so happy." A lot of times they're crying, they're so happy.
Yeah.
They come back the next time, and some of them are kind of pissed off
Yeah.
because they go, "I suffered for X number of years and I didn't have to
Yeah.
because I was misinformed and that was
Right.
BS and I was told this and everybody was saying that," and they're mad, and they
Right.
should be. Women should be mad. And I don't think that we can have an honest conversation about why hormone replacement therapy is important until we can have an honest conversation about how many people we've killed
Right. Yeah, you're right.
because we said no to this thing that was always good and
Right.
believed this bad study that we knew was bad within a few years after it was published.
Oh my goodness. I think too, just I love that you challenge the study and the science behind it because that shows you not only your personal drive and your practice, but also just you're always willing to show up and challenge the status quo almost. Just from talking to you now, I think that's incredible attribute.
You absolutely have to be in medicine, and the longer you're in medicine, the more willing you are to do that, I think.
Yeah,
But medicine has these blind spots,
right.
and you have to look beyond those blind spots, and
Mm,
and you can't if you're just kind of stuck in your
yeah,
narrow career treating these things that walk in your door.
exactly.
You have to open up your eyes
Yeah.
and look around.
So tell me a little bit for our local listeners, where can they find RegenCen here in South Florida?
We've got 4 locations in South Florida now. We just opened up the northernmost one here in Southeast Florida in Vero Beach.
There we
Great
go.
office,
Great office for all our
and
northern listeners. That's
that's right.
incredible.
And I was just there a few days ago. We had our kind of grand opening, beautiful little space, and right on the island,
Mm,
and it's great. And then we're in Hobe Sound
okay,
and Wellington
great.
and Palm Beach Island on
Beautiful.
340 Royal Palm.
I know. And also, shameless plug here, we have our event coming up with you shortly in
Yes.
a couple weeks, and it will be at the Palm Beach location. So we're
Yeah.
excited to visit.
Palm Beach is a great place for events, and at that office is a great place for events. And we've had a lot of great events just in the past
Right.
couple of weeks. So
It's
a
good.
lot of enthusiasm at Palm Beach Island.
Before we wrap up here, really quick, I want to touch on just the fact that people are paying more attention now to their health and
Mhm.
to their family members' health as well, if it's genetic or anything like that. Could you just provide some sort of guidance on the over amount of information there is for all of these symptoms? Like if people are just Googling their symptoms and they're like, then they jump to the worst conclusion. What would be your best sort of guidance to those people that's like, no, like go talk to somebody, you know?
You're absolutely right. There is so much information out there, and you'll be able to find this huge bell-shaped curve from hormones are all evil and you should never do them to every single one of us should be on them when we're 30
Mm,
and max dose and
right.
more than physiologic doses and all this stuff. And so really, who cares what all those people say? Because you're not trying to figure out what's best for the nation here, Mrs. Smith or Mr. Smith. You're
Right.
trying to figure out what's going to work for you.
Right.
So come to an expert, come to somebody who does this every single day.
Mm.
We're unique because, number one, we're menopause certified providers. This is the majority of our business at the regenerative side of
Wow.
the practice. About 75% of what we do on the regenerative side is bioidentical hormones.
Wow.
And so we're menopause certified. That's a special certification that it just kind of, it just gives you assurance that we have at least this baseline level of knowledge that a lot of people don't. And then beyond that, we do this every day, all day long. We
Right.
treat thousands of patients, and the more you treat and the more unique circumstances you run into, the better perspective you have. And really just come in. We don't want to put any barriers there. Complimentary consultations initially. Tell us what's going on, what
Right.
you're thinking about. You'd be shocked to see how many people do great on this level of hormones and lousy on that level of hormones, and how it differs from individual to individual.
Wow.
Hormone replacement therapy nowadays, when it's practiced best, is all very, very individualized and symptom focused. We want to keep people in a very safe range, a scientifically proven range that's good, that's safe. We know there are no bad side effects within this range. But within that range, that's a huge range. For
Right.
guys, it's like a range of maybe 3, 4, 500. For women, it's a big, big range.
It is,
And so
yeah.
you have to get really precise with people and precise with that balance. And then I'll put in one more kind of shameless plug if we're talking about
Absolutely.
that. If women go to their conventional doctor, either their OB-GYN or their primary care doctor, a lot of folks are saying now that the FDA said that, okay, I guess I'll do that now, even though I've never done it before
Right.
and was against it for 20 years and was telling people not to do, I'll do it now.
Right.
But those folks aren't going to have the experience level, and they're not going to do testosterone.
Right.
Because testosterone is not FDA approved. And this is another big blind spot doctors have on how the FDA works and FDA approval. Women make more testosterone in their lifetimes than estrogen by like a factor of 10.
Oh my.
And even after menopause, when women make 0 estrogen and 0 progesterone, they will still make a small amount of testosterone for the rest of their lives.
Wow.
So testosterone is really crucial to balance and really crucial to replace in women. That's what gives women physical strength and stamina. That's what maintains their muscle mass. It maintains their bone mass if they can't take estrogen. For example, women who have had breast cancer can't take estrogen.
Right.
It doesn't cause breast cancer, but if you've had breast cancer, you can't take high levels of estrogen, but you can take testosterone very safely. And that really does a lot for people in terms of that energy and motivation and physical stamina and disease prevention. By the way, women can take vaginal estrogen after breast cancer as well.
Really?
So blah, blah, blah. I'm kind of just giving these examples where whatever you've been told about hormones is probably wrong. And you want to go to a hormone expert that sees a lot of different things and a lot of different people and is up on all the latest and greatest in scientific truth
Yes,
about hormone
exactly.
replacement.
Oh, I love that. Well, I always love to close my interviews with some rapid fire questions.
Yeah.
Okay.
All right.
So just the first thing that comes to your mind, and then we'll kind of wrap it up. Okay.
Okay.
Coffee or tea in the morning? What's your go-to order?
Tea.
Ooh, okay.
White tea, usually.
White tea. Okay, great. Hot or iced?
Hot.
Hot, hot, hot. I
I'm
love it.
Chinese.
I love it.
Hot
That's
tea.
good. Hot tea. Your favorite hidden gem in Palm Beach?
That little place of Royal Palm and whatever that other street is. They have this booze cart that they bring around. It's like after dinner.
Lagaloo.
Yes.
Lagaloo, yes.
Yes.
Oh, good. Okay. It is so good. Somebody else said that today, so that's really funny. I love that. What is one book that changed your life?
Right. You really want to know?
Yeah, I want to know.
It's this book by a retired Navy SEAL, and it's called Extreme Ownership. And it's about not pointing fingers, about taking responsibility for everything that's within your purview, even if it's not your direct responsibility. If you think to yourself, I could have had an impact on that, then you should have had an impact on that.
That's so good.
So
Take
anyway,
ownership, you said.
It's called Extreme Ownership.
Extreme Ownership. Okay.
Jocko Willink.
Beautiful. I will link that because I'm a big book person. And then lastly, what is one piece of advice you would give to your younger self as you navigate life in the workplace?
Yeah. That's a great one. I got a bunch of advice for him. I would say, don't be so defensive and be more willing to admit ignorance.
Mm, that's so good. Oh my goodness. Thank you, doctor, for joining us today.
You're welcome. Thank you, Keanu. Those are great questions. I'm going to keep some of those for my interview
Oh,
questions.
do it, please.
Thanks a lot.
Of course.